Welcome back to OTW Pod. I'm TJ Halverson, and today I'm joined by John Matthews, the CEO of InkWell Health, who's created a smart temporary tattoo that gives clinicians real time data on patient recovery. John, thanks for joining us.
Thanks for having me, TJ. This is a lot of fun.
Yeah, I'm really excited to get into this story. And, I think before we get into what you guys are solving with Inkwell and the current status of the company and all the success that you're already starting to have, let's give our listeners a bit of a background on who you are. How did you get involved with Inkwell? Where did you come from?
Yeah, so my background is orthopedic sales. So I started as a sales representative with DePuy. Then they got bought by Johnson Johnson, so I worked inside a little bit at DePuy J&J in Canada, and then had the chance to start up be a distributor for a little bit. So I did that, and then I got recruited to a company called Wright Medical. You guys all know who they are. And I was
Hmm.
I worked my way up to the general manager role for the Canadian subsidiary. So I was the general
Okay.
manager for Canada for many years. I had just a great experience. Got involved in a lot of U.S. activities. At the time, they were called high performance management systems, and I was involved in several of those projects. And then when the hip and knee business was sold off to MicroPort, I stayed on with MicroPort as their vice president of global orthopedics and helped
Okay.
them really start
Yeah.
their first orthopedic company. And that was a lot of fun.
Yeah. Ah, that's really interesting. So, that's a long career with some of the biggest names in ortho. How did you go from this, giant orthopedic company background to a startup? You know, how did that
Well,
happen?
it fortunate again in 2018, I got recruited to a company called Canadian Hospital Specialties,
Okay.
Canadian hospital supply company, and they were owned by a company called Cortex. So I learned a lot about private equity. Their
Mm.
goal was to get the company sold, basically. And so, with a great team, we tripled the value of the company and got them sold to a company called FlexPoint Ford 3 years later.
Mhm.
And then with that money, I started Inkwell. I had the great opportunity to start my own
Okay.
company.
Nice.
Yeah.
Nice. Yeah, that's some great experiences. How did you What were some of the key insights? We had talked earlier about there were multiple insights along the way that you learned, whether it was at Wright Medical or MicroPort, and some of these challenges that you saw specifically within, let's say outpatient joint surgery and how surgeons are tracking their patients post-op, right? How did you get these insights and then build it to what Inkwell is now solving?
Right. Well, I'll talk a little bit about where Inkwell came from, but back in my orthopedic career, orthopedics was rapidly changing. There was a
Hmm.
significant shift in the you know late 2010, 2018, 2015. There's significant shift to the surgery center market, outpatient total joints. And
Hmm.
so that was really changing the landscape of orthopedics in the United States. At the same time, there was a number of bundle payment initiatives. If you remember all of, the bundle payment programs that were being put in place, and Medicare was looking at a
Hmm.
bundle as well. So there was these, constant shifts in the market. And to be blunt, the orthopedic companies were very afraid about, all of this having a dramatic impact on the price of the implants. What I
Hmm.
saw in a lot of the projects that I was fortunate to lead at the time are, building programs all around outpatient total joints or joints moving to
Hmm.
surgery centers was ultimately in that shift. There's, the patient outcomes could be in jeopardy because,
Mm.
again, that's an entirely outpatient model. The patient goes home either the day of or the next day after surgery, and they may not see the orthopedic surgeon back for several weeks. They may or may
Mhm.
not have physical therapy. Physical therapy, the projection was that at some point, physical therapy would also be included in these bundles or value
Mhm.
based payment models. And that could have a significant impact on patient outcomes, complications, and et cetera. And so all of that was in
Mhm.
my mind as the idea of Inkwell came to fruition.
Mhm. So let's get into that origin story. It started off as what, a bandage?
Yeah,
Right?
so there's an orthopedic surgeon in Canada, Dr. Michael Gross, who was, constantly asking me to look at his idea. to
Mhm.
monitor a post-op bandage, which was very
Okay.
interesting. You know, he had a very novel
Mhm.
idea, and his primary motivation was again, he didn't really know or didn't have visibility into how his patients were doing until he saw
Mm.
them back,
Mhm.
and oftentimes it was too late. So it was a really cool idea, but of course, the difficulties of it were it was a post-op bandage, which is a very
Right.
difficult market,
Right.
as you know. I did,
Yeah.
did a significant a research project into that. I interviewed 30 plus orthopedic surgeons and physical therapists in the US, and they were all very intrigued by the idea. And the same
Mhm.
themes kept coming up. It'd be great to know how the patients are doing. Even if they go to physical therapy, they oftentimes will have significant swelling or pain or issues. And one of the
Mhm.
biggest, things I hear from payers is, the number one problem they're facing these days is patients going to the emergency room after surgery. And that's even
Yeah.
with patients going to physical therapy 1, 2, or 3 times a week. And so, these themes kept coming up over and over and over again. And while it was a really great idea, the bandage is only on for 7 days, right? And so, what do you do
Mhm.
after that? And then, of course, the issues with monitoring a bandage. And so, I was one of the very great surgeons I was interviewing or discussing the idea with. Dr. Jimmy Chow was, thinking as Jimmy does, thinking about the idea is, wow, that's really cool. What if we put that on the skin? And so InkWell Health was born.
Wow. Wow. What if we put it on the skin? How did you then make that pivot to say, "How does this work? How are we gonna put it on the skin?" You know, uh, talk me through the technology now that you had to create.
Well, so the cool part is clearly it was a common theme with everybody we spoke to. So we thought that there was a real need here that we could address. Now we had to prove technologically, can we do it? Can we use markings, not sensors? These are simply markings, right? Can we use markings on
Mhm.
the skin, a post-op bandage, compression stocking or sock or anything like that? Can we use these markings to monitor movement and assess things like
Mhm.
swelling, range of motion, and temperature? And so then we had to prove we could do it. So we did a number of proof of concept programs, had a great
Mhm.
group of people in the US that I was able to work with, Mike Carroll and others who are just brilliant people. And so, we worked with them to prove that we could actually do this. Then
Mhm.
at that point, then we had to actually build a computer vision based algorithm that could then just
Mhm.
use a smartphone to basically scan these markings, just like you scan a QR code, and then
Yeah.
ultimately recreate the position of all these dots and crosses in 3 dimensions to provide clinicians
Hmm.
with swelling, range of motion, and temperature. And so at that
Yeah.
point, after we proved the proof of concept, I was very fortunate to find a computer vision expert, a guy named Gary Long, very long history of excellence in this area. And so, we basically partnered up. He and I basically partnered up to build Inkwell.
Wow. So, how does it actually work, right? Because if we look at the photos, there are all these little dots and crosses and squares. You have to obviously solve them for a bunch of different variables with different phones or lighting or angle that the patient then takes the photo of their knee. How does that all work? Break it down for us.
Yeah, so to keep it simple, at the very start, wasn't about all the problems. It was about all the just basically recreating that 3D scan to keep it simple. So
Hmm.
essentially, our early algorithms were looking at the movement of dots in 3 dimensions. So it basically the computer vision algorithm takes a 2 dimensional template and can recreate it on the skin and find all those dots in 3 dimensions. And then we can use the movement of the dots to assess the change in surface area, which is an estimate of a change in swelling. And now our
Hmm.
algorithm actually uses the dots to create the circumference change of the leg. And so now we're actually able to assess true swelling change. And then the crosses are essentially used to measure the range of motion. And we're unique because
Hmm.
we provide clinicians with the functional endpoint range of motion, meaning the the
Mhm.
patient fully extends their leg and the crosses are used to get that measurement. Then they fully flex their leg and the crosses are used to get that measurement. And so the
Mhm.
first image that the patient takes really becomes that kind of baseline image, and then it compares
Mhm.
everything to that image throughout the
Mm.
patient's recovery journey.
Mhm. So I assume that the first temporary tattoo is then put on probably, post-op by one of the nurses or someone in the OR. And then does the patient apply? How long does it last? Does the patient have to do anything? Walk me through that.
Right. So right today, all of our clinicians put the tattoo on right after surgery, usually done by
Okay.
the PA or the OR staff or the resident. It's really easy to
Mhm.
apply. The leg, they're usually putting it on, right after they break sterile. They put on the post-op bandage, and the patient's while anesthesia is waking up the patient. They apply the tattoo, as we can show in an image here. They apply the
Mhm.
tattoo to the inside of the patient's leg, wet towel, 30 seconds, peel the paper away, and really just like the temporary tattoos we had when we were kids. And so it
Yeah.
literally takes 30 seconds and it doesn't impact the workflow
Hmm.
of the orthopedic team whatsoever. We're doing a couple
Mhm.
fun studies where we're putting the tattoo on preoperatively as well,
Hmm.
which I'm pretty excited about some of that research that we're doing. But again, the team puts it on right after surgery. The first tattoo usually lasts about 2 weeks, and then after
Mhm.
about 2 weeks, my team will help the patient reapply the second tattoo themselves, and they do a great
Okay.
job. It's very easy for them to put it on themselves. Then they go home with 3 backup tattoos that usually gets them to 2 months.
Okay. Okay. And then the system with the computer vision then adjusts for all the variables between how each tattoo is going to be slightly different than the last.
Well, and so you were mentioning earlier about all the problems we had to solve for. So that's what took a significant amount of time and work. And we're
Hmm.
actually submitting for a patent for all of that work that we've done because my CTO has basically combined several PhD theses to create this
Mm.
new algorithm that effectively, not only does it scan these markings, the temporary tattoo like a QR code, but we've corrected for different phones, lenses, offsets, angles, lighting, all of that we
Wow.
had to correct for. So my CTO can
Hmm.
tell you not only can tell you the 3D scan, he can tell you where that patient held the camera from, what angle. And so he's had to solve for all of that so
Yeah.
we can provide what we call medical grade data to the clinician. And so,
Hmm.
having a patient set up a phone and be like in a green screen type environment like you would see motion
Hmm.
pictures taken at where everything's constant. Patients might
Hmm.
one day be on their bed, one day be on a couch, one day be on a recliner, holding the phone in all
Right.
sorts of different positions. We've solved for all of that. So it's easy for the patient. They can,
Hmm.
make an entry however they want, basically. And our algorithm can solve for all the positions and recreate that 3D scan from the dots. Now, if you can't see any dots because the patient's holding the phone at the completely wrong side of the leg, well, then they're going to get
Hmm.
a null entry. But that
Right.
that you're not taking a picture of your tattoo at that point.
Yeah. Wow, that's incredible. So you went through all this, kind of beta testing, getting some clinical results early on. Can you walk us through some of those early results that you've seen in any of the case studies? And now you guys have how many patients have you used this on? How many patients are in this database?
Yeah, we're now over 3,000 patients, which is pretty incredible. And
Wow.
really
Okay.
special thanks to some of the key sites in Michigan where, people that I knew from my past life of orthopedics took a chance on me, basically.
Mhm.
And they really
Mhm.
helped us get going. So, Don Kanapke in Michigan, Dr. Angelini, and Dr. Nelson, just great guys. They were our early beta
Mhm.
sites, helped us work
Mhm.
through all of the not problems, but all the workflow learnings where how to work with an orthopedic office and how to work with them during that patient's recovery process, how to onboard a
Mhm.
patient, how to report information back to the clinicians if there's patients are off track or critical alert. So we've learned a
Mhm.
ton through the last year 2 years, but we really
Mhm.
didn't launch the product until the AUKUS meeting and the American Academy of Hip and Knee Surgeons meeting in 2024. So really not
Okay.
even a year into our first year of sales. Like I guess coming up this November will be a year. So, you know,
Yeah.
significant beta testing and really a year of sales to get to 3,000 patients is pretty amazing.
Mhm. Mhm.
And sorry to
Yeah.
answer your question, but what we've learned
Yeah.
is, really a couple things. What's most fascinating to me is how, and I can't say we can diagnose. We're not a diagnostic tool. We're a data tool
Mhm.
to the clinician, but it's very
Mhm.
compelling how the clinicians can use this data to identify patients that are off track. And it's
Mhm.
incredibly powerful, this kind of combination between swelling, pain, and flexion, where you can
Mhm.
identify
Mhm.
very early patients that are at risk for either a manipulation or a surgical site infection. And then, on top of that, patients that have significant swelling and pain issues, those are the ones that go to the emergency room department. The number one reason why patients go to an ED department is because of swelling. And so,
Mhm.
those three things, which I'm happy to show some examples here, have just been really exciting results from over the last year.
Yeah. What are you guys seeing in terms of the clinical value proposition with this data?
Right. So that's many aspects to that question. So for the patient, the
Mhm.
value is, ultimately that, they can see how they're doing compared
Mhm.
to, published trends of what a recovery journey should look like for swelling, range of motion, temperature. So it's very empowering for a patient because they can see how they're progressing. They're very engaged, and ultimately they love that their clinician is monitoring them. They
Mm.
absolutely love it. It's an incredibly compelling value prop for the patient. And ultimately, they want to have a good outcome and they want to avoid complications like a manipulation uh,
Mhm.
or a surgical site infection. And they ultimately
Right.
want to get back to whatever it was they were doing before, whether it's golf or, other activities or just, feeling healthy and being active. For the
Mhm.
clinician, there's many different aspects of value as well. Some love this because of the reimbursement opportunity, and our
Mhm.
clinics are making more money with the remote monitoring codes that they're billing for this technology. Some
Mhm.
clinicians love the fact that they can use this to market to patients, uh, and ultimately, our best and longest using customers are using this to be more efficient and effective in how they manage patients. Ultimately,
Mhm.
they want to know how their patients are doing, and we even have one of our biggest clinicians using this now to better manage his follow appointments. And so he
Mm.
was seeing
Okay.
patients two or three times during the global period, and now he's seeing them one or none, and he's seeing new
Mm.
patients and billing for a new patient eval and generating
Right.
new surgical patients. And,
Mhm.
these patients who are doing well, he has data that they are doing well. He doesn't, have to bring them back. Of course, if the patient wants
Mhm.
to come back, he's going to bring them back. But, now he's got a
Right.
way to help his team be more effective and efficient, especially, his practice is a very, very busy orthopedic practice. But ultimately,
Mhm.
all these clinicians want to know, they love the data. They want to know how their patients are doing in a very quick, easy way.
Mhm.
And they want their patients to have a good outcome. And of course, everyone's talking about PROMs, patient reported outcomes, and patient satisfaction. And this is a great tool to help you get there.
Yeah. Yeah. So a few, I guess, a few follow up questions to that. So because the patients are loving this potential for better outcomes for themselves, I would assume that their compliance rate is fairly high. Do you guys have any data around that?
Yes. So that's probably one of our biggest strengths is our patient compliance. And when
Okay.
I say compliance, I mean, specific to the reimbursement codes for the patient entries. So in order
Mm.
for you to bill that reimbursement code, the patient has to make 16 days of entries in a 30-day period. And we get
Mhm.
that 82% of the time, which is incredible.
Yeah.
And we actually did a clinical series, a multi-site clinical series in Michigan, and our patient
Mhm.
compliance in that series was actually 87%. But of all of our patients, we bat about 82%. So 8 out of 10 patients
Okay.
make more than 16 days of entries in a 30-day period, which is pretty
Mhm.
incredible. Which shows you that the patients
Yeah.
like it. They're making the entries. They see the value in this. And ultimately,
Mhm.
that's important because the patient needs the data to help monitor the patient. They also need the data to submit for the reimbursement for the codes.
Mhm. Mhm. So I'm assuming there's some sort of like gamification of the app that engages that patient and makes them wanna get those 16 days?
Well, right now there's a lot of automation in the app where it sends a patient a reminder. Our app also has an
Mhm.
automated text system that a lot of our clinicians use to set up
Mhm.
automated text to the patient. And then,
Mhm.
of course, on the app, the patient can see how they compare to published literature for patients'
Okay.
recovery with flexion extension. And as we get more
Mhm.
and more data, we absolutely want to gamify this to show patients how they're doing relative
Mhm.
to similar type patients. It's
Right.
fascinating, even the difference between a right and a left knee replacement. There's subtle differences, which is pretty
Really?
cool. I'm really looking
Really?
forward to using
Interesting.
all this data to make it fun.
Uh-huh. Yeah, interesting. I'm excited to see the difference between the left and the right. We'll have to talk about that more as you get more of this data. Now for the clinician, do they also have some sort of automations built in to, hey, the patient's temperature is starting to spike? Do they get an alert? How does that work on the clinician side?
Yes. So when we set up a new clinic, they will set up their, I call it their default recovery goals. Some surgeons
Okay.
have one goal, they want them at X degrees at 6 weeks. Some surgeons
Mm-hmm.
have daily goals. It's a big range.
Mm-hmm. Mm-hmm.
Regardless, once you put in those goals and metrics, the system will be able to report to the surgeon that, hey, this patient is trending on track or off track. In
Mm-hmm.
addition, you can set it for things like if there's significant swelling, it'll send you or your PA or whoever you want it to. It will send
Mm-hmm.
that person either an email or text critical alert that something has happened. Usually
Okay.
it's if the patient is over 20% swollen in a day, which is a pretty acute
Mm-hmm.
event, or if there's
Mm-hmm.
ever a temperature alert above
Mm,
102. The literature says above 102, you should be worried. And above 104, you should really be worried. So our system
mm-hmm.
only sends a temperature critical alert if the patient's 102 degrees Fahrenheit or higher.
Mm-hmm. Mm-hmm.
And so
Interesting.
the clinicians can now automate all that. Some of our
Mm-hmm.
clinicians, set it and forget it, and some of our
Mm-hmm.
clinicians are in the data every day, but it's
Right.
again, you can set these alerts, and then ultimately you can go into the portal and you can see the patient's recovery graph, and very quickly
Mm,
you can use that data to identify trends or patients that might be
mm-hmm.
at risk for something like a manipulation or an infection.
Mm-hmm. Mm-hmm. That's great. So let's talk a little bit more. You'd mentioned briefly some of the reimbursement components. How does that work? How have you navigated the landscape of, surgeon versus PT? How do you work with each of those different groups? Is there partnership? How does that enable ultimately better outcomes? Right. A couple different thoughts within that, but let's talk about the reimbursement component first.
Right. So, of course, we can sell the solution to an orthopedic surgeon or to a
Hmm.
physical therapy clinic. Our target audience right now is orthopedic surgeons that own their physical therapy clinics. But we
Okay.
can also talk later about a program we have for orthopedic surgeons that don't own their physical therapy. But for
Hmm.
those surgeons, we ultimately charge them for for the service, and
Hmm.
then they submit for the reimbursement codes. And
Got it.
all of our clinics actually are submitting the remote therapeutic monitoring codes and
Hmm.
getting reimbursed. So these are
Hmm.
some people still consider these relatively new codes, but they've been
Hmm.
uh, part of the CPT codes now for several years.
Hmm.
And of course, there was quite a bit of learning for me to do in that whole reimbursement post op world.
Yeah.
But we're
Yeah.
very experienced now in how to build the codes, what processes to put in place to successfully build
Hmm.
the codes, and how to
Hmm.
manage the different payer mix that a customer may have to best
Hmm.
implement a remote monitoring program and to be successful in reimbursement. So that's probably
Hmm.
other than the algorithm, that's probably one of our biggest strengths that we help clinics do all
Yeah.
of that.
Yeah. What do you when you go and you talk to one of these orthopedic practices, what are the typical questions or obstacles that you have to overcome for them to ultimately partner with you guys?
Yeah, first is really just understanding their payer mix.
Mhm,
Then if how best then to implement a program. Then of course, if
mhm,
they have their own physical therapy, then those codes are usually are typical will be part of their payer contract. So that makes that easy. If they don't
mhm.
have physical therapy as part of their payer contracts, then we have to manage that, which isn't hard. It just takes some time. We can
Yeah.
help them through that process as well so that they can build the codes, even though
Mhm,
they didn't previously have physical therapy as part of their group, their practice.
mhm.
And so we usually those are the big things. And then the implementation piece, really the hardest part there is just everybody's so busy, right? And so
Right.
getting, our what we really integrate into a practice really seamlessly. And our
Okay.
strongest strength is that our excuse me, our biggest strength is that we make this easy for a practice. So,
Mhm.
what I mean by that is, basically usually the scheduler sends us the patient's information. We onboard the patient. We answer all their questions. We make this
Okay.
super easy for a clinic. And then we
Mhm,
even help the patient, making their first entries. And then we hand the patient back to the clinic. We even have a
mhm.
program now where we can continuously monitor that patient for the clinic. And then that
Oh.
obviously helps the patient. It helps them meet
Mhm,
the guidelines for billing all of the remote monitoring codes. But we had to
mhm,
work through all that processes to make this easy for a clinician. But the hardest part
mhm.
is the first little while is getting everybody on the same
Right.
page, right? Because everyone has very different ideas of remote monitoring, what it is, how it works. There's
Mhm.
various levels of knowledge and experience with the codes, and I say this very carefully, but there's a lot of distrust uh, with with getting paid, and so we work through that with clinics very
Mhm.
meticulously, and obviously it's working. Otherwise, we wouldn't have any customers. But all of our customers are
Yeah.
sticking with us and loving the programs we put in place, and so that's really the hardest part, is just getting
Cool.
everybody on the same page, answering everyone's questions, and
Mhm.
then working with them to put in place a very easy process. And again,
Mm.
our strength is that we do all the heavy lifting so that they can focus on what they need to do. Because to be blunt, everybody in an orthopedic clinic, from the scheduler to the PTs, are incredibly busy, overworked,
Mhm.
and oftentimes want to do remote monitoring but just don't have the time to do it. So we can help those
Right.
clinics.
Mhm. So I know we've discussed some of these case studies. Are there any specific stories or examples that you think would be beneficial to share with the greater audience at Orthopedics This Week and give someone some of this real world information or, you know, connectivity to say, hey, you know what? I just had a patient like that. This would have been incredibly powerful for us.
Oh my goodness, that's so fun. We publish every patient testimonial, good or bad, on our website. So we have a
Hmm.
ton of them on there. And the
Okay.
comments we get are extraordinary, and are a lot of them are very moving. Um,
Mm.
the other example would be from our clinical series. There were 4 manipulations, and happy
Hmm.
to show them, but you can very early see that the data, could have been in that clinical series. They weren't using the data to manage the patient. We were just using the
Hmm.
data on an existing cohort just to show that this thing can work. But
Hmm.
you can very quickly see that the data was very compelling and would have
Mm.
identified and hopefully prevented these manipulations in our clinical series. Fast forward now, our clinics are using the data to take action, and I'm happy to say that we've had lots of patients with the first few days, first few weeks, showing very concerning recovery journeys, and then they took action to prevent
Hmm.
that. Similarly, we
Yeah.
have some good stories, not stories, but case studies where we were helped prevent a couple patients from going to the emergency room, and we helped
Okay.
we actually, in that series of 100 patients in our multi-site clinical series, we actually helped
Hmm.
catch and prevent 2 surgical site infections, confirmed
That's
infections, which
awesome.
is pretty cool because of the
Yeah.
temperature. So those are really fun stories. But then you back to the our website with the patient testimonials.
Uh-huh.
You hear from the patients who are, they just love the data. They love to be able to see how they're doing. And
Hmm.
in addition to our InkWell data, we also have an InkWell version of Dr. Wickline's post-op protocol and the
Uh,
patients love the combination of those two things because not only do they have data on how they're doing, but now they have, really cool protocol that they can follow to
mhm.
really, you know, ultimately recover on their own from home. And that's pretty powerful.
Yeah, yeah. Really, really, really interesting, John. Um, you know, you guys are starting off obviously in total knee replacements, but let's talk about the future, right? I think it's exciting to not only cover where you are today, you guys are a year into this, some great data coming out of it, but how do you see this evolving, in the next few years? What other surgical applications or even non-surgical applications do you see for this technology?
For sure. I'm excited again just to, really use the data we have to start to gamify that recovery journey and the
Mhm,
process for patients. And, right now we're really focused on post-surgical knee patients, but of course, the non-surgical population is a very exciting area that I've got to focus on
mhm.
because the data there could be just incredible. But we're
Yeah.
actively testing a foot and ankle tattoo right now. I've
Okay.
actually got one on my foot. I can show you. It's pretty cool.
Really?
And we're actively testing a hip tattoo. We're
Okay.
actively testing a compression sock, which is
Mhm,
pretty cool. And then, we want to look at swelling and temperature with the shoulder. We're not testing
mm,
that tattoo yet, but that'll probably be the next one we start testing. But pretty
mhm.
short order here, we're going to start to roll out a foot and ankle tattoo, a hip tattoo, and then start to
Yeah.
look at a compression sock. Um, and
Mhm.
then we can not only can we look at foot and ankle patients, but we can start to look at and manage lower leg lymphedema
Yeah.
which is a
Wow.
huge
That would
market
be
in the US.
yeah, that would be incredible. That would be really incredible. So really this is all about building this bigger ecosystem of personalized recovery and creating a new standard of care.
Right. Our focus is providing clinicians with data on swelling, motion, and temperature. But
Mhm,
ultimately, what you said is perfect. We want to not only enable this data to be used on everybody, but
mhm.
drive ultimately our goal is to provide data that clinicians can use to personalize a patient's recovery.
Let's zoom out for a second as we're starting to wrap up. Where do you see InkWell Health in the next, let's just call it 3 to 5 years?
Oh, very, very fun question. Well, ultimately our goal is to get acquired.
Mm,
One of our biggest strengths is our technology. One of our, to be blunt, our areas of improvement is the team. We're a very small team. So for us to now, we've proven there's a need. We've proven the reimbursement. We've proven the business model, and now we've got to scale this. So we can either, do a very large series round and build a huge company, which is an option. But ultimately, I think being acquired and partnering with an orthopedic leader or a remote monitoring or physical therapy leader to really take this to the market and really apply it broadly
mhm.
is where we want to be in 3 to 5 years.
Mhm. Mhm. Definitely. So, for the listeners that we have quite a number of people who are in the trenches with you, right? Early stage founders, startup entrepreneurs, even people just with an idea right now. If you would, why don't you share with us some of those lessons learned as a founder? Let's start with a very basic one, but an important one. What's the hardest lesson learned as a founder so far?
Yes. So ultimately, raising money was a very difficult process and a difficult thing to learn. And then, ensuring that you have the focus to make sure that, you say no when you need to, you say yes when you need to, and you spend every dollar on the right things that drive your business forward. Because you can get
Mhm.
very easily sucked into a lot of things that, may be great things to do, but not, not at the stage you're in. And so
Mhm.
that
Mhm.
continues to be a huge lesson for me and a very valuable one
Yeah.
as we focus every dollar that we have on driving sales and profitable sales now, which is fantastic.
Mhm. Mhm. Yeah. Yeah, those are very important lessons that a lot of people don't learn until it's too late, unfortunately.
Right.
So as we're headed into, well, we're already in Q4 here of 2025. What are you excited about most through the end of the year or through the first few quarters next?
Well, I'm very excited for AUKUS. That's going to be another great meeting for us. We're a big part of Dr. Wickline's symposium, which will really focus on swelling, managing swelling, pain, and optimizing motion. And for him,
Mhm.
it's minimizing opioid use, which is a very important subject. So really excited about AUKUS. We've been now on the podium at a couple events, the New York Orthopedic Society meeting, OSET. So
Mhm.
that's great. We were just published in International Business Times, so that's an incredible piece of recognition for us. And I'm really excited that we actually have a very large opportunity outside of the U.S. I wasn't going to expand outside of the U.S. For some time. Our focus still is
Mhm.
the United States because it's a critical market for us, but we have a very large opportunity uh, in in uh, in another country. And so
Mhm.
we are proceeding with that, and we'll hopefully have that um, that customer onboarded in December, doing cases in January, which will be a very big moment for InkWell
Nice.
Health globally. So I'm really excited about.
Yeah.
And then because of that very large opportunity, we are doing a small seed round. So I'm excited to get that closed and to get me some help because ultimately,
Mhm.
this very large opportunity has some regulatory costs that we've got to cover, and I've got to get some help in the US so that I can continue to accelerate that sales growth because ultimately that's the
Mhm.
market we want to be successful in and we want to focus on.
Yeah. Yeah, absolutely. So if there's one thing that you want a clinician to walk away from after this conversation with InkWell Health, what is it?
Fun question.
If you had to narrow it down to one or two sentences, John. It's easy. Come on.
So we can help them with a remote monitoring program because
Mhm.
everyone really sees the value in doing that economically. But we can help them with the right process. We can make it easy. We can provide them a pathway to build a code. But ultimately, we can give the orthopedic surgeon and their physical therapy team medical grade data on how the patient is doing to not only prevent a complication but to optimize that patient's outcome.
Yeah. Wonderful. Well, John, thanks so much for joining us on
DJ.
OTW Pod. This is a really fun conversation. It's a great technology that's going to ultimately, I think, change a lot of people's lives. So kudos to you and the team, all the work that you put into this. Wish you nothing but success and growth ahead. I'll see you in a few weeks here at AUKUS. And to everyone listening, thanks for tuning in. Go check out InkWell Health. And if you're going to be in Dallas at AUKUS, come by the booth, learn more
Would
about the technology.
love to meet you.
All right.
Thanks, TJ. Really
Yeah.
appreciate you having me.
Great. Yeah. Thank you, John.
Thanks.
Take care.
Bye.
Bye bye. Thanks for joining us on this episode of OTW Pod. For more insights and coverage on the latest in orthopedic innovation, visit ryortho.com. Don't forget to subscribe on YouTube, Spotify, or Apple Podcast, and we'll see you next time.